Hi viewers, how are you? Hope you are all doing well. Today I'm gonna discuss acute shoulder pain and the disorders causing that pain, their symptoms, their diagnosis, and their treatment. Now, first of all, we should know that what is acute pain. Acute pain is any kind of pain that is sharp in quality and that is sudden, and that doesn't last more than 6 months. Here is a list of disorders that cause acute shoulder pain. Now, first of all, number 1 on the list is a clavicular fracture. This type of fracture is most common traumatic injury in the young adults. It is also known as broken collarbone. Symptoms: fracture at the fracture site, localized swelling, as well as decreased mobility in the affected arm. Diagnosis: Diagnosis can be physical as well as with the X-rays, but X-rays will confirm the diagnosis. Their AP and cephalic tilt view is mostly used. Treatment is conservative. Figure of 8 strap or sling is mostly used. These are worn for 2 to 4 weeks. A follow-up radiograph after 4 to 6 weeks is done. Number 2 is a proximal humeral fracture, commonly caused by a direct blow or fall on an outstretched hand. On physical examination, crepitus at the fracture site is often noted. Ecchymosis within 24 to 48 hours is usually seen. Symptoms are same as that: pain, swelling, and immobility of the affected arm. Diagnosis is confirmed with the X-rays. AP and lateral view is used for the proximal humeral fracture. But if the fracture of the greater tuberosity is there, then it can be detected by the axillary or a Y view. Treatment is conservative by the shoulder immobilizer if fracture is displaced less than 1 cm. But if the fracture is displaced more than 1 cm, or if that is a complex fracture associated with the anatomical neck or with the neurovascular injuries, then the surgery is the best option. Number 3 is a scapular fracture that can cause acute shoulder pain. Results from the direct blow to the scapula or extremely high force impact elsewhere to the thorax. Symptoms: tenderness at the fracture site, painful arm abduction on the affected site. Diagnosis: AP and axillary or lateral view of the shoulder. If high force trauma is there, then a chest film and trauma series of the humerus are carried out. Treatment is conservative by the sling. Early range of motion exercises should start after the acute pain subsides, usually after 2 weeks, to avoid the complications like frozen shoulder. Orthopedic refer for the unstable fractures. Sprain of acromioclavicular joint. What is sprain? Sprain is any type of ligamentous injury. An acromioclavicular joint is between the acromion of the scapula and between the clavicular bone. This is the most common injury among the athletes and the young patients. Occurs due to the direct blow to the superior aspect of the shoulder, lateral due to the deltoid area, sometimes due to the fall on an outstretched hand. Symptoms: localized swelling, tenderness over AC joint. Diagnosis: an AP view on the X-rays. Treatment is usually icing and sling to immobilize the areas to avoid the further complications. Sprain of sternoclavicular joint. Separation of the SC joint is of 2 types. It can be anterior and it can be posterior. Anterior separation occurs when the medial end of the clavicle is displaced anteriorly due to a motor vehicle accident. Posterior dislocation of clavicle can be life-threatening due to the pressing of the neck veins. Symptoms: pain with the shoulder adduction, localized tenderness and deformity, and head tilted towards the injury. Diagnosis: it is difficult to detect with plain film, so a modified view such as 40 degrees cephalic tilt is useful. Treatment is usually conservative with the sling or figure of 8 strap. Progressive range of motion exercises are done. Dislocation of humerus. It is due to the slippage of the humeral head over the glenoid fossa. It can be anterior, posterior, or inferior depending on the mechanism of injury. Anterior dislocation, however, is the most common. Symptoms: feeling of looseness and instability, affected arm placed in external rotation, and abduction. Diagnosis. Physical tests and x-rays are used, AP view and an axillary view of x-ray. Treatment. Relocation of humerus and immobilization. Mobility of the elbow and shoulder can be resumed in 7 to 10 days. For recurrent dislocation, open surgery is used. Rotator cuff tear. Most common in person older than 40 years and mostly due to the chronic impingement syndrome resulting in the rupture of rotator cuff. In younger population, mostly due to the trauma. Symptoms: pain, feeling of heaviness and weakness. Diagnosis: X-ray, AP view show calcific tendonitis. Treatment: surgical repair in young and selected older individuals. Repair within 3 weeks of injury is recommended. Others: shoulder pain can be any cause, like it can be either of internal structures or it can be referred pain from the neck, head, or upper limb. Referred pain or shoulder can also be due to the problems in internal organs like heart, stomach, kidney, liver, etc. Thank you. Have a good day. Now press the like button and comment on this video. Subscribe my channel. Have a good day.